Good afternoon. Now I will discuss with you the second part of the urinary complication during postpartum, that is the urine incontinency. It is a common complication after birth. So type of incontinency may be overflow incontinency, stress incontinency, true incontinency, urge incontinency and neurological incontinence. So first we will discuss about the overflow incontinence. It is occur due to the various factors. The number of factors, first is urinary retention. Incomplete bladder empty lead to overflow of the incontinence. Bladder trauma or stretching of the bladder during childbirth lead to flow incontinence. Third one, the nerve damage. Nerves that control the bladder function, if damaged, may lead to overflow incontinence. Fourth one is hormonal changes. Change in the hormonal level affecting the bladder function such as the estrogen and progesterone. Now the sign and symptom of the overflow incontinence. The first sign and symptom is leakage of the urine. Small amount of the urine leak out often without any warning. So patient is not able to assess कि urine is passed. It is passing the unconsciously. Frequent urination. Need to be urinate frequently but pass some small amount of urine. Difficulty in emptying the bladder. Feeling like that the bladder is not empty completely. Radiological evidence show residual urine in the bladder. Now the management, how we will manage the patient if patient is coming in overflow incontinence. So first we will catheterize the patient to reduce their discomfort and pain. Pelvic floor exercise, mother should advise for the Kegel exercise. So demonstration must be given to the mother regarding the Kegel exercise. Bladder training, so timing was also given to the mother regarding the interval of the urination. Adequate intake of the fluids. Patient should take adequate amount of the fluids. Next is the stress incontinence. Usually manifest late puerperium. In this, urine will be escaped through the urethra during the stress. It is common issue that can affect many women. Sign and symptom of the stress incontinency: leakage of the urine. Small amount of the urine leak out when coughing, sneezing, laughing, engaging in the physical exercise. At that time, small amount of the urine will leak out due to that stress. Next one, the incontinence during exercise. Urine leakage during exercise or other physical activity. Loss of bladder control. There is no control over the bladder. Next one is the weakened pelvic floor muscle lead to the stress incontinence. Hormonal changes, change in the hormones during pregnancy or postpartum can affect the bladder function. Increase the pressure on the bladder lead to stress incontinence. Now the management of the stress incontinence. Pelvic floor exercise, I already discussed with you. There is a Kegel exercise that will help in the strengthening of the pelvic floor muscle. Lifestyle modification. So in this lifestyle modification, we will advise the mother to maintain healthy weight, avoid uh, heavy lifting, etc. Next, managing constipation will help to reduction in the stress incontinency, because during constipation we will put the pressure of the pelvic floor muscle that will uh, lead to stress incontinence. Bladder training, increase the time between the urination. Physical therapy, there is a rehabilitation regarding the pelvic floor muscle exercise. So we will advise the mother to join that clinic. Use absorbent product and device. So we will advise the mother that she can use the pads and pastry that will help to maintain the hygiene. Dietary changes. Avoid food and drinks that can irritate the bladder. So we cannot use those food and drinks just like coffee and alcohol that will increase the urination. Avoid heavy lifting. So we will not lift heavy, that will put the pressure on the abdomen and there will be a stress over the bladder and In that condition, urine will leak from the bladder. Medical intervention. So physical therapy, we will advise the mother to join that clinic where the Kegel exercise was teach to the patient. Medication, some alpha blockers can be given to the mother. I have already discussed this thing in previous lecture. Surgical opinion, we can take some surgical opinion regarding the ligation of the bladder or uplifting of the bladder. So that will help to in the stress incontinency. Behavior therapy. So we will advise the mother to modify their behavior. For example, that will reduce the weight, and she should maintain the normal weight, avoid heavy lifting. So that is the behavior therapy. She should not take that food that will irritate the bladder. So this is about the complication. I have discussed two complication in two parts. One is the urinary retention, or second one is the urine incontinency. So third one, I will discuss the postpartum complication of the urine, that is the urinary tract infection. So it will deliver into the next topic. So thank you.